8:32 right now, the third largest city in New Jersey seeing a spike in COVID cases. Paterson reported almost 300 new cases on Friday, while the rest of the Garden State is almost surpassing 4,000 new cases a day. Here with what is going on and what is next for the city of Paterson is the mayor, Andrew Sayegh. Good morning, sir. Thanks for being with us.
Good morning. How are you?
I'm doing well. The question is, how are you? Before we get to the numbers, how are you feeling? Because I know you recently were exposed to COVID-19.
I was, but for precautionary purposes, I decided to quarantine. I had 2 negative tests. I am a previous positive, asymptomatic. So I'm back and leading from the front. And my city needs me now more than ever.
Absolutely. But that's interesting that you previously had it and then it sounded like you were exposed again with the antibodies and everything in the system. What did this tell you, this journey of yours?
So originally in April, my symptom was I lost my sense of smell and I had pneumonia on my left lung. I didn't have any upper respiratory issues, nor did I have a fever or a cough. This time around, no symptoms whatsoever. But like I stated before, at an abundance of caution, because I had come into close contact, a member of my team tested positive. I said, let me just play it safe, take myself off the field, and then I'll come back once I have 2 negative tests and remain asymptomatic.
Well, that's really important because let's talk about the numbers now. New Jersey reporting nearly 4,000 cases on Sunday, 15 deaths. But in your city of about 150,000 people on Friday, 278 cases. That's the highest since the pandemic began. What is going on?
Correct. Well, we were very successful in the first round of knocking out, or should I say, crushing the curve. But the second wave is here. And from what I've gathered, I get anecdotal information from my contact tracing team, particularly my public health officer. He's saying that a lot of the spread is just people gathering indoors. A couple weeks back, well, actually a month ago, I issued an executive order restricting hours of operation for certain establishments, and then the governor backed
the midnight curfew. Is that what you're talking about?
Yeah, and then the governor came in and said, let's do 10, and of course I'm amenable to 10. And if we have to, everything's on the table. We might have to do it again. But in speaking to my public health officer, he's saying that the spread is occurring in the households, which is really, I mean, people are going out, bringing it in, and then the household gets it.
So how do you stop that? Because you can't send officers into everyone's home. How do you stop the spread then?
So here's what we do. We're telling people that there's a level of personal responsibility. Continue to wear your mask, keep your distance, practice hand hygiene, and we'll crush the curve again. In Paterson, we're testing more than we have ever tested before. In fact, we have a mobile testing unit, and that mobile testing unit is in every ward every day. So we have 6 wards, 6 days they're in there testing, and we're testing over 100 people a day. With our mobile testing unit alone, the hospital's doing testing, and then there are independent doctors in Paterson that are testing as well.
But Mayor, with all due respect, you say wear your mask, wash your hands, protect yourself, social distance, and we'll crush this. But we've been telling people that for months, and we're not crushing it right now. So what do you do?
So here's, like I stated before, everything is on the table. I just spoke to someone from the governor's office this morning asking if they were going to take any additional measures. And what I say is everything is on the table. If we continue to see a surge, then we're going to have to tighten the screws like we did last time. But I'm fairly confident that we will be able to reduce the caseload here in the city because we are known for our contact tracing. So we're testing, we're tracing, and that'll help us, we believe, suppress the spread again.
How well is that contact tracing going? You say you're known for it, but we've spoken with officials in many other cities who are telling us quite frankly that people aren't coming with the information. They're withholding that information.
Yeah, well, in speaking to my public health officer, he's saying that we're getting cooperation for the most part. You're always going to have someone who definitely doesn't want to release any information. They feel like this is a private matter. In fact, with some people, getting the virus is a little bit embarrassing, so they'll be less reluctant to share. But I will tell you this, we've been successful and will continue to be successful. The goal is to not get overwhelmed. If they get too many cases, it's really hard to trace.
At what point is your threshold? Because you say everything's on the table, right? What is that threshold where you do start to shut things down?
Yeah, that's a very good question. So we're looking at a number of metrics. 1, our daily infection rate, which you cited earlier. 2, the hospitalization rate. I spoke to the president of the hospital on Saturday. And also we're looking at the calls for service to our ambulance. What we're also seeing is that although more people are getting infected, it's not as lethal this go around.
Yeah, why do you think that is? We've been talking about that here as well. Is it because we've learned more information? Is it because the drugs are better? Why do you think that is?
There's a whole host of reasons. I think we're better prepared. The therapeutics, remdesivir, and these steroids that they're giving to individuals, then obviously the cocktails that Donald Trump, Chris Christie, they were given. Then there's also the masks. I think masks are very important. Wearing a mask will allow you to inhale or prevent you from inhaling as much of the viral load. Therefore, that will lessen the severity of the actual virus. We've seen research from scientists that indicates that.
Got it. And I guess if anyone has experience with it, you do, considering you came down with it and then you were exposed recently. Hey, you stay safe, and we need you there and doing your job as we head into this holiday season and this second wave. We appreciate what you're doing.
Thank you. Happy Thanksgiving.
You too.
And don't have too many people over.
Oh, yeah. No, it's a very small household, let me tell you. Thank you, Mayor.
Thank you.
Take care.